Hello, good afternoon, and welcome to the fourth of the Isle of Man Government's coronavirus Q&A briefings. And perhaps, who knows, without wanting to tempt fate, we're approaching one of the final of such sessions, given the ever-improving situation on our island, but we'll wait and see on that one. The man in the middle today is the Chief Minister, no less, Howard Quayle. I will be putting your questions to him on your behalf, predominantly about COVID-19, but other related issues as well. Now, it has been a week for milestones, and today, and I appreciate we won't have today's figures just yet, perhaps a milestone again with the small m, in that once the figures are out shortly, if we have gone another day without a case, it will have been 30 days, effectively a month without one. And that is probably cause for some kind of optimism. I think cautious optimism has been the mantra throughout all this. In fact, I can spot a bottle of elderflower down there. Perhaps we could have our own live Howard o'clock drink, raise a glass to the figures. But in terms of the position you were in 4 or 5 weeks ago, did you ever envisage, Chief Minister, being in this situation you are in now?
Well, I hoped we would get into this position, but I didn't expect it to happen so quickly. I did a tour on Friday around Ramsey District Cottage Hospital and Nobles Hospital to thank all the team there for everything that they had done, and I went to see at Nobles Hospital some of the key projects I'd been working on in the National Strategy Group in the early days, and I'm working on, and I'm not saying panicking, but really the urgency to get 50 extra beds at Nobles Hospital, to create extra intensive care beds, to provide an oxygen generating plant, because your biggest defence for people coming into hospital with COVID-19 was being able to, we've all seen the pipes that go up your nose that feed you with pure oxygen, and we rely on that being shipped over and then stored, and it comes over, it lasts for about 2 weeks, and then we get another tanker. Now, if that tanker hadn't been able to come over because of either A, bad weather, or B, that the UK needed it, or there were so many people with it that they didn't have enough drivers, we would have been in real trouble. And these are all the things that were going on early on in behind the scenes that we were desperately putting in place, and at no time did we think we would be where we are so early on in June, really.
Optimistic news. Let us go to our first caller, because I've got a nice... In fact, before we just go to our first caller, I've got a lovely question here from Rob on a lighter note. Inevitably, the issues of borders will be raised, but he's asked, what is it like to preside over what he has described as the most popular Manx government in decades? He says, in memory, the general public have been both very supportive of the decisions required and delighted with the progress made against such a deadly virus. Of course, you won't need me to tell you that opinion can change like that.
Yeah, I always think of the Frank Sinatra song, That's Life, and it goes, you're riding high in April, shot down in May. And I'm under no illusion that, I'm not perfect, neither is my team. We will no doubt drop a clanger at some stage, and I just hope people will bear with us. We do our best. What I've been really delighted in is I've been getting lots of emails and letters from the public who say we've never had any interest in politics before, but we've really enjoyed the broadcasts that we do. And I've always wanted, it's quite funny, I don't consider myself to be a politician. I'm just a Manxman who stood for a period of time to do their best, because I believe in intergenerational fairness and ensuring that the next generation have a good future, that we don't pile a load of debt onto them and we're too easy on ourselves. And I didn't expect to be where I am or whatever, but I did want to connect with the people better. And I don't know, we tried all sorts of things to improve, to up our game, to get that connectivity there, and it never seemed to work like I wanted it to. And then, so if one good thing has come out of this is that the government is able to speak to the people of the island far better than we have done. And I think the people of the island have seen that we're just human beings. We're just one of them doing their best for the island. And I think that's really helped with the connectivity between politics and the public. And that's something good to take out of this.
And hence perhaps the requirement, the support to keep these session's going, because certainly we've been inundated again with questions today. We'll come to those. Let's go to our first caller, though. Alan is waiting in Douglas. Alan, please put your question to the Chief Minister.
Moramai, Alan.
Moramai, Mr. Minister. How are you?
Yeah, not too bad. A week's sleep wouldn't be something I wouldn't say no to, but other than that, I'm keeping well.
That's pleasant. Yeah, first of all, I'd like to say thank you to everybody in government of what's been achieved in the last 4 or 5 months. The position that we're in today is, an amazing relief compared to everybody else in the world. So, a big thank you to everybody in government and everybody who's done this work. So well done, I have to say. I have a question for you. Last week, Jeff made quite a public announcement that the government approached a non-Manx registered design firm to design the NHS worker appreciation stamps. Initially, the story was denied, but later confirmed. What have you done to ensure that local businesses in all sectors are given equal opportunity to compete and not discriminated against because of their size?
Yeah, well, obviously, I didn't know anything about this until it broke, because it was the Isle of Man Post Office, I think, who had done the design and were in charge of that. I can't micromanage everything. I am the person in a previous life who started with a number of others the I Love Manx campaign. But, to buy Manx when I was the vice president of the Farmers Union at the time, and I felt we needed the most profitable way of selling your goods is selling it locally rather than having to export it, because then you've got all the costs of exporting into a market where you haven't got the economies of scale, so you get less effectively. So I started that. So I have been passionate about buying local and getting the Great Manx public to support local. And I think the one good thing that's come out of this, I got a lovely email from Isle of Man Meats yesterday, and which is quite ironic given your question. And he said that their sales are up 42%. Now, one thing that when the boat hasn't been able to sail, or if it hadn't have been able to sail, whether it's bad weather or through illness in the UK, we've never wanted for Manx meat, whether that be beef and lamb. We've always had milk and cheese and butter on our doorstep from the Isle of Man creameries, and Ramsey Bakery delivering bread, the bread round the island. But I know that there's so much gets brought into the island that we produce. And when that boat doesn't sail, I know the orders go up by about 10,000 a day or something on the loaves. And the minute the boat gets back in, Ramsey Bakery are dropped for those 10,000. And we as a Manx public, we've got to get better at saying, look, we want to support local. And whether it be graphics, whether it be our food, our local shops, I think it's hit home to people that if we don't look after ourselves and our own business, when the chips are down and things are really tough, we've got to stand on our own 2 feet or our 3 feet from the Isle of Man point of view. And therefore, anything that we can do to help the local economy and what's known as the multiplier effect. I gave a talk once when I came up with the idea for a 50 million fund to do more inside the Isle of Man economy, because I think it's about £1.82 you get back for every pound you spend on the island. So I was disappointed to hear that we'd given the work off island. It is being looked into. Equally, that said, you can't have businesses think, well, we're the only one on the Isle of Man. We've got the contract, therefore we'll add on 50% of the costs. And everyone has to make a profit. I get that. I'm a businessman myself, but there has to be a fair profit. So we've got to balance it that if someone can do it for £100 and we're being charged £1,000 on the island, you can't condone that. But you should always give local business the opportunity and the margin of costs. If they're slightly more, but there's the economies of scale, you should take that into account. And I know Treasury are looking into that. Very long-winded answer, but it's it's not just the graphics, it's a wider thing, isn't it?
Yeah, no, I absolutely believe you in the buy local policy. It's really important that we maintain a food stock for, we've seen in Corona itself that it's been a difficult period on the shelf, so we must support local, and government is a good place to start to lead the way with it. So I thank you for your answer.
Thank you very much.
Obviously, a local business owner in Douglas yourself. While you're here, we'll put a second question to the Chief Minister.
Yeah, certainly. I think last year there was the government completed a cannabis consultation. There was some 4,297 respondents, which is around 67% of the population. One of the most shocking statements I took from this consultation was that 99.2% of the people responded want cannabis prescribed for medical use. Now, I have a friend that suffers from MS. Her only respite and relief comes from cannabis. During the lockdown, she suffered through lack of access, condition has deteriorated, lack of drugs not available. Normally, she has to buy this off a drug dealer because it's not available through the state. What can you say to ease her pain?
Well, I can't ease the pain at the moment. There are oils that have the hallucinatory bit taken out that you can get from chemists, and some doctors will prescribe. But I have had meetings with businesses on the island who are looking to set up cannabis growing and producing of medicinal cannabis. Now, it might sound, yeah, let's go and do it tomorrow, but we have to do it right. There's lots of legislation, and we've got to ensure that the Isle of Man is seen to be doing it responsibly, and otherwise there could be a lot of damage to our reputation. So I think on the whole the government or the Council of Ministers is supportive of the idea of growing a variant of cannabis on the island for medicinal use. I'm not personally supportive of allowing growing normal cannabis without the elements taken out from the hallucination point of view. When I was Health and Social Care Minister, I toured some of our mental health facilities, and I talked to a couple of young people. When I say young people, in their teens, and their eyes were black. They had really bad reactions, and that was them for the rest of their lives. That was the side. Not everyone gets that side effect. Some people are absolutely fine. So personally, and I think the Council of Ministers share this view with me, we will support medicinal cannabis growing on the Isle of Man, but there's a lot of money to do it properly and to set it up, and we have to get the regulations in place. And I know just before the outbreak of COVID-19, I had been in meetings with a number of business people on the island with our Department for Enterprise to help take this forward, and then obviously something's like COVID-19's come along and put that on the back shelf, though that is one of the areas we're starting to kickstart again.
So would you concur that you're aiming to position medicinal cannabis purely for private business rather than private individuals?
I don't know enough about the concept of growing it. If you allowed individuals would then be able to buy it on the Isle of Man from private business. If you would have to go down an awful long way of saying, well, I'm growing cannabis that's X variety, and that means that it's purely for medicinal purposes, and there's the other with the more serious consequences of taking it, that how would the police differentiate?
Tetrahydrochloride, which is the hallucinogenic part of the plant, is an active painkiller that has been used since the 1990s in the Israeli Health Service. So to still have an outdated opinion where it's going to make you crazy and make you do silly things is a little bit miseducated.
Well, I will just have to beg to differ on that one. I know when I was health minister, I had a letter from a father in Ramsey, and it had destroyed their family and his son smoking cannabis. So it's not whiter than white, but there are elements of it that can do good for people, and the medicinal side I will fully support, and if business want to do it, we will work with them to help get that up and running. But growing your own on the island, I'm afraid, well, I'm Chief Minister to no.
Alan, Thank you for your honesty.
The Chief Minister's obviously given his answer. There's 15 months till a general election, and I would be staggered if this wasn't probably in the top 3 of issues in certain quarters amongst certain candidates next year. So I'm sure this debate will continue in its various guises. Alan, do stay on the line, because we will come back to you for a further question a bit later on. Thank you, Chief Minister. Let me turn to a question now, and another question here. We're talking about borders, and of course we know that the majority are very supportive. They want the borders to stay closed as long as possible. There are others who believe that now we should be looking at opening them as soon as possible. You will never win. There'll be those who have the polar views. But as to when to open the borders, what specific indicators do you think will be used to trigger that decision?
Well, I don't think there will be a big opening on a certain day. Everything will lift. I think I've always been a big fan of taking steps and then looking at the data, seeing what happens, and then if nothing's caused a big rise on the island, then you take another step. Now, we've taken some big, bold steps of recent, but we had the data to back that up, and that created our own bubble. I mean, I don't want us to be a Brigadoon, if you know the musical, forever, but we have created a bubble where we on the island can get on with our lives again, with slight restrictions in certain areas, but the rest of the world isn't allowed in. And I think, you know, I've said publicly, I've had meetings with my counterpart in Guernsey where they have no cases to see, can we do a travel corridor there? Then if Ireland, say, giving you an example, gets down to no cases, we can maybe send, you know, allow people to go on holiday in Ireland and vice versa. The quarantining, the big defence, which we've used, New Zealand have used, Guernsey have used, is that 14-day quarantine when you come back. So you go away, you come back, you quarantine for 14 days, and that 2 people have come back to the island that have left for various reasons. One was a key worker and one was on patient transfer. But because we had the 14 days, that saved the island because they didn't spread it anywhere. And it's a tough one. If a vaccine comes out, then that's a game changer. If a test comes out that, whether it's a finger prick or a swab that says you either have it or you don't, that's clear, then that is a game changer on board. At this moment in time, the best test we have will only tell you it when you're showing signs. You can carry the illness for 10, 12 days and you will pass that test. So that's why we have the 14-day quarantine. So if technology improves, and well, not technology, if the medicinal side of things improves, quite ironic when we've been talking about medicinal cannabis, if there's a new test out there that enables us to do a test and say, yes, you haven't got it, and be confident you haven't got it, then the borders quarantine will have to stay for some time. Though we are looking to ease it going forward for our own people to leave the island, because we know that when they come back, we can make them quarantine in their own home. It's going to be tough to bring people over who aren't locals, though that will be one of the later steps.
Greg is asking, has a time scale been discussed at ministerial level?
No, you can't come up with a times. You can come up with a stage approach and ideas on how it will work, but I genuinely didn't expect to be in the position where we are in early June to be able to do away with the 2 metre to 0 social distancing and to try and virtually have the island back to normal. So you can never say never. It really is what's happening with the spread in the United Kingdom. There are some counties, I'm told, where they haven't reached their peak yet. Sadly, the Northwest, where we've got an awful lot of close friends and good working relationships, they're seeing their R rate nearly at 1. So you've got to look at the data, really, and that's what will advise us on making changes. So I've never been one for saying on the 5th of August we'll open the borders, because you just don't know what's going to be happening on the 5th of August. I would hope that by sometime August, September, we can relax. I know our students are going back to university, and how are we going to get them back? Most parents throw everything on the car and drive them there, help them unload and come back. Now, we may hopefully be in the position where that can happen. Parents can drive away, but they will have to quarantine when they come back, unless by then a new test has come out. But at this moment in time, the data I have is that we'll probably be able to allow people to go away to do that sort of thing, but when they come back, they'll have to self-quarantine, which is a pain for people. I know it's 14 days when they can't go out, etc. But equally, I am convinced that there are people walking around the island at the moment who are alive that wouldn't be if we hadn't have tackled this so quickly and kept that 14-day quarantine.
Without knowing it, you've actually answered one of Anna's
right.
questions on education as well, so thank you for that. Her second question is, she was talking about university, September, etc., going back. There's a fear that if a second wave of the virus hits, we may not be able to get students back for Christmas. She says, can you reassure the parents that their children will be allowed back home, even if it means they have to self-isolate, as they did at their end of the second term this year? I mean, it's trying to be a bit of predict the unexpected, I suppose, that isn't it?
Yeah, well, I've said if we get, God forbid, coronavirus or COVID-19, as the purists like me to call it COVID-19, because it's not coronavirus, because there are many variants of coronavirus, and I think everyone knows what I'm talking about when I say coronavirus, but to respect the purists who do email me if I touch the lectern or don't say COVID-19, then I will say COVID-19 for their benefit. You just don't.
No.
You just don't know. But I would sincerely hope that if we get it back on the island, we won't have to go back to square one again. We now know what's worked, because we never had a blueprint for this. Yes, we had a plan if there was an influenza outbreak or avian bird flu, etc., but we didn't have a blueprint for this. We might go back to 1 metre social distancing. We've got the test, trace. That worked really well. We've got the infrastructure set up on the island. So I don't think we'd have to go back to where we were at the very start. But you can't say never. But I would hope that if there was a spike again in the UK, we would be able to allow our young people back. But the quarantine would have to happen for 14 days unless, as I said, there's this test, which I hope will come along and will say whether you've got it or not. And you'll know then that you can allow people in.
Thank you. While we're talking about the borders, I suppose the island hasn't fully felt the impact of Flybe yet, because I think they went into administration and collapsed, 10 days or so before we all started to go this way. So with that in mind, a question from David here. How concerned is government, and obviously EasyJet's announced about 1,000 job cuts as well, how concerned is government that there will be very limited options for travellers when the flights resume, and indeed high ticket prices for limited seats?
Yeah, it's something we were discussing before the outbreak and during the outbreak, because obviously whilst we've got the outbreak and no planes can travel, you've still got to think, well, when they open up, you want to make sure that they see the Isle of Man as a profitable place to do business, because our links, especially with the Gatwick flight I use all the time to go to Westminster, and I know an awful lot of business like the City connection or the Gatwick route. It's really important that we have these connections, and we will have to review our policy of having an open skies policy, because it's a new world out there. There are some airplane companies who may not survive. If you look at Warren Buffett, I think he's withdrawn all his investment in the plane industry. For example, he sees it for 5 years. There's going to be no profit there. Now, he's a far better financier than I will ever be, and you tend to look at what he's saying and think, yeah, he's probably right. So we may well have to do a deal with a company to say, right, we'll guarantee a certain number of flights yeah. or seats, or Guernsey have their own airline company. I'm not going to try and pronounce it. They lose a shed load of money on it. I think 10 million a year is there or thereabouts, and that 10 million, if I have to find 10 million to do our own system, then I'm taking that maybe from the health service or someone's pension fund, or not being able to recruit enough police force, or dare I say it, potholes on the road sort of thing. So it's a fine balance. But obviously, if we don't have good connectivity, then businesses won't want to be on the island because they can't get to where they need to be. So
potentially, could this be an opportunity for the Isle of Man government to try and encourage an airline company to encourage more flights to safer destinations?
Yeah, well, as I say, I don't want to prejudge what I'm doing, but I have had negotiations with Guernsey, who have their own airplane company, and they could fly to the Isle of Man and back again. So that's something we're looking at. But that's not going to solve the issue of the vast majority of business people who want to getting off the island to go to their either parent companies or travel further afield to America, for example. So we do recognise it is a really important issue, and we will do our utmost. With me, nothing is ever in tablets of stone. You have to react to the situation.
Let's take a further question now, thank you, because this has come in regarding family members. They're caring for a terminally ill relative in Ireland. They wish to return. If they return, can they self-isolate at home? I think the answer's yes
Yes.
on that.
Yeah,
I think that's
yes on
fairly
that
well
one.
known. Will the rest of the family have to?
Yes.
That's a yes as well, isn't
Yeah.
it? 3 of them need to work. Could the returning family stay in the same house but avoid sharing the same rooms? I think
No.
that's a no,
No,
isn't it?
that's an absolute no. I mean,
Yeah.
I understand that the inconvenience that this affects people, and I know some of our self-catering tourist accommodation on the Isle of Man have been renting out their units to people for a fortnight at a good rate, because they haven't got any business coming in with tourism, and they're people. So if you're a young person at your home and your mum and dad are on holiday in America and they want to get back, then the young person's moved out into a tourist accommodation and the parents have gone home, or equally the student wanting to come home has gone into some of our staycation places that we're calling them now, to enable people not to have to self-isolate, to quarantine, and they can carry on their work. Now, I know that's a great inconvenience, but at this moment in time, our biggest gun, our defence, which is really, there's 3 things which have got us into this fantastic position: the Great Manx public, the fact that we never stopped testing and tracing, and the 14-day quarantine, and we closed the borders. And the 14 days of quarantine is our defence mechanism, because if you self-isolate for 14 days, then you've not spread it on to anyone unintentionally. And I know it's a great inconvenience. I've had to quarantine for 14 days, everyone in my household, because I obviously got it. So I know what it's like. But if it means we save lives of our vulnerable, whether it be pregnant ladies or people over 70 or people with autoimmune illnesses, then surely that 14 days of inconvenience is a small price to pay to save the lives of our loved ones, our neighbours, and our community. So
You will never please all of the people all of the time,
No.
of course you won't. But tell me, did it in those early days, when the warnings were given from the government to islanders who were in far-flung parts of the world, come home, you have a certain amount of time to come home? Some did, some successfully made it back, some tried to and were stopped at every hurdle, whether they were on cruise ships and ports refused them entry or whatever, and others continued to post their holiday pics on social media and said, we're going to do this today, we're going to do that today. And in some cases, I've seen it myself, they were the same ones who complained then that they had to go into self-isolation, often in the Commerce Hotel initially, for 14 days. They didn't make the effort to come back earlier. Did that personally irritate that some people who were the biggest critics of the government were those who perhaps weren't following the advice and were determined to go down their own path?
yeah, that's been the toughest one of of handling. Well, obviously losing life was, for me, emotionally very upsetting. And having to tell people you can't come over to see your mum because she's dying because we don't have, that's the current rules. Those have been, the most upsetting things in my political career that I've ever had to do. I've had an awful lot of abuse behind the scenes over repatriation, and my team get awful abuse from some members of the public. Now, there are genuine people out there who have gone away because their mum and dad has been dying, and they were there before the outbreak, and they've needed to go in and look after the interests of their loved one, or people who've been in a far-flung corner of the world that suddenly shut down. They couldn't get back despite their best efforts. And I have the deepest of sympathy for those people, because they couldn't help it. But I think Minister Ashford himself, over a 7-day period of time, told people, get home. If you can, get home. We gave as much notice as we did. And in the end, there was only 300-400 people who were stranded. The rest were people who repatriated. When you look at the figures, you've got key workers, which was hopelessly over-exaggerated, unintentionally, because we had to give blanket cover to all the drivers of BOC who provide the oxygen, all the steam packet staff and the Royal Mail workers who don't set foot out of the airport runway, but technically needed advice. So when there was one person who'd been holidaying in Spain with their motorhome. Spain was the second most infected place in Europe at the time, and had decided until right at the last minute that they were going to come home, when they could have the data would have, if I'd have been in Spain and seen the figures that were there, I'd have got out of there straight away. So it's been a tough one because there are genuine people who have been impacted by this, and they felt stigmatized by the abuse that the public have shown to other people. So it's been a really tough one. But I have to say, I have had some lovely letters and emails from people who've stayed at the Comus Hotel who said the Comus Hotel could not do enough for them, and they didn't want to go public on that, but they have been as many as the people who have really gone for me. And it's disappointing that, but I suppose as a politician, you've just got to take it on the chin. And it's the staff who've had to deal with it that I do feel sorry for, who've really had some unpleasantness. But we're getting there. We're trying to make it easier for people all the time. But when we learn more, because we hadn't done this before, I didn't want to shut the border, but it was the best thing to do. And hindsight is a wonderful thing. We have streamlined it, that no longer do you have to go to a set place, that you can go home if you want, though some people have continued to use the Comus because it offered a good service. But if you look at New Zealand, you have to go into a special base there. You can't go home. And because of people abusing that, they've now called in the military to run it. So what we've done and what they've now done, we're quite reasonable.
Those who shout loudest often get heard, Chief Minister. Tell me, Judith is asking, if a vaccine is the only long-term solution, when one is approved, will the government provide that for everyone? Or given the probable cost involved, will people have to buy their own as some sort of health passport in order to travel freely?
Well, I think the Isle of Man government will buy the vaccine. We've bought 10,000 of the antibody tests, and that gives us an indicator of who's had it. And I know so far, the workers that we've tested, I'm hearing on the data, who didn't think they've had it, haven't had it. So the fact that on the Isle of Man, and that's something, in the early days, it was worrying me all the time, was PPE, the masks, the gowns, yes, the gloves, to protect our frontline healthcare workers, whether it be in nursing homes or Nobles Hospital or Ramsey District Cottage Hospital. We took a decision early on that we would get out and try a number of different companies to get that supply source. We cleared out the National Sports Centre and turned it into a big storage area for PPE. As a result of that, we were able to give our staff the very best protection known, and it would appear so far that it worked.
Just leading on to that, actually, Jenny says that the government still advises workers in certain settings, such as hairdressers, to wear PPE. When will it be likely they'll no longer need to do this, as despite the safety reasons, it does appear to restrict their work?
Yeah, all we can do on this side of things, this is a medical fight against the virus, and we take advice from our public health and our medics on a regular. Now, we don't always, they're not running the island. It is the Council of Ministers that makes the decisions and then takes them to Tynwald to either agree or disagree with us. But I think things like dentistry, because of the sort of work that goes on, the atmosphere there is known as, it's called aerosol, is the technical phrase, which people might think is like a tin or something, and there's a greater chance of giving that infection to our dentists. So that's being reviewed, where they might have to continue for a little while longer. When it comes to nail bars or hairdressers, I would think that in a fairly short period of time, we would be able to say you don't need to do that anymore. But on that sort of a thing, I take advice from the medics. I'm not a qualified medic on this sort of thing, and I think it would be foolish if I didn't listen when it comes to hairdressing. So I understand, yes, it will slow them down. I get that, but if it means they're safe, their client is safe, and the community is safe, then again, it's a small price. We've all had to make sacrifices. Some people have lost their jobs. Sadly, some people have died. Some people have been seriously ill. Some businesses have gone under. People's mental health has been affected with isolation, etc. And we've asked people to shield for weeks and weeks. So an awful lot of people have had to make sacrifices to get the island to where it is now. And I just ask people to carry on. Yes, it's an inconvenience, but if it means we stay safe, then surely that's got to be worth the while.
Talking of jobs and work, Alan, I think, has to get back to work. So we'll go back to Alan now if you want to ask a further question to the Chief Minister.
Awesome, thank you. Right, I have a question that's quite important to me. Reporters from Norwegian online magazine VG Helm indicate that there are at least 149 IP addresses based on the Isle of Man which are downloading child abuse material from the internet in the 10 months of 2015. This particular set of information is available in the public domain. Since 2015, there's been few convictions, a blocking of Sarah's Law, a blocking of Notfield investigations, and a bill to move the House towards and a bill moving towards the House to protect accused paedophiles of entities. Can you say your government is doing everything it can to protect children over paedophiles?
I appreciate that's not COVID related as such, and you will not have statistics to hand, but I'm sure you want to reply.
Yeah, well, it personally for me is very sickening that people would want to watch this sort of thing, and even worse, carry it out on a child. And for me, you know, personally, and this is a personal view, I'd lock these people up, and I wouldn't be giving them a get out of jail card in any time soon. But I know our police do an awful lot of work behind the scenes. There are some things that go on that I cannot talk about, investigations, etc., because we don't want it being damaged. But the police have been successful. They work with American law enforcement agencies on this area to share information on, and so they will tip us off that we've got some of our residents who are doing it. It's not an Isle of Man thing, it's a worldwide issue, and it's sickening and disgusting what goes on, and anything that we can do to protect young people, we will of course do, and we give our full support to our police force who do the investigations and the prosecutions on this.
Thank you.
Thank you very much.
Thank you, Chief Minister. Thank you, Alan, for your questions as well on a wide array of topics, and much appreciated as well. Thanks for your contribution.
Thank you.
Thanks very much indeed. Just move on to finance now, if we may. I have a question here about government and how will it look to rebalance the books after the significant borrowing that's obviously been required over the last 3 months. Could there, this questioner asks, be a temporary permanent rise in income tax or some other measure? Oh, that tax question again.
Yeah, well, it's a tough one because obviously the initial forecasts from Treasury of where we thought we were going to go and for how long the burn was going to happen haven't been quite as well, the reality hasn't been quite as bad as what we thought. We put it into two camps. One is the income from tax and VAT, etc., to Treasury, and sometimes that can take a number of months before you see what the impact is. And I think we'd estimated initially about 70 million a month is what we would lose. And then the others was the 6 schemes we've come up with. It was going to cost us we thought it would cost about 30 million a month. So that's your 100 million a month that we were going to be out of pocket. Now, because of the quick measures that we put in place and the Great Manx public following all that, we are not in as bad a position as we thought we were going to be. We've been able to open up the economy, but beyond a shadow of a doubt, we've got an extra 1,000 probably people unemployed at the moment. There are people furloughed whose businesses, I'm afraid, will not open again, and I would expect, whilst we're seeing the unemployment rate coming down because the construction industry is now opening up more and taking on more people, there will be some businesses that sadly will not open again, and we do have a problem. So if you park that, there are a number of ways of tackling it. The island's unique selling point is tax efficiency. And I know in the United Kingdom they put the top rate up considerably and took in less because people either left or moved the money out of the United Kingdom. So it's trying to get a balance. The Department for Enterprise are telling me at the moment in time that they're getting unprecedented levels of interest of people wanting to move to the Isle of Man because it's handled the COVID-19 situation really well, and it's seen as, well, we've got the lowest crime rate in the UK, second or lowest in Europe. It's seen as a safe place to be, and that may well be something that we need to push more, and therefore we can grow our way out of this. If you cut too deep, and we've already had, one of the reasons I put my personal life on hold and stood as a politician was I was really worried that we had this black hole of public sector pension debt that no one had tackled. We were hemorrhaging money from our reserves to balance the economy. And I started this interview discussing about intergenerational fairness. Our young people, I wanted my children's generation and their grandchildren, our grandchildren, to have a good future on this island. And if we go too easy on ourselves and just rack up debt for our young people, it will force people off the island because the taxes will be too high. So it's a really tough. I haven't got an answer. Is the honest answer. We are looking at ways of doing more capital work on the Isle of Man to help the economy, and then you've got the multiplier effect and and help the island grow its way out of the situation. We have not borrowed money at this moment in time. We are using reserves. Our reserves are not a bottomless pit. So yes, we may well have to borrow money. It's cheap to borrow money at the moment. We'll have to decide what.
It's not always cheap to pay it back.
That's right. You've always
Yeah.
got to pay it back, James. So I can't give an answer. I am cautiously against raising taxes because it could have the opposite effect. It'll bring you in less money. And our unique selling point as a business for the Isle of Man is our tax efficiency.
We have 4 more questions. I just want to
Right.
touch on antibody testing, if I may, because Stephen's asking, are the results going to be published? Because you'd imagine by now that there will be some reportable numbers to indicate how widespread the virus has been on the island.
Yes, it's our intention to share the information. I'll have to speak to my good friend Minister Ashford on when we're going to start doing that. But yes, I think once we've done enough tests and it can't be traced back to an individual to give people their privacy, then of course we will be sharing that information with the public. We've bought 10,000 tests, but in 2 trenches of 5,000, the shelf life of it, if you buy it now, it only lasts till the end of July. So we need to do the 5,000 first and then do it in the next. So yes, we will share it. It will. It's not going. It doesn't. It's not the be all and end all of COVID-19. But it's another tool. It will tell us how many people have had it, how many of our frontline people had it that maybe didn't know they had it. And there's an awful lot of people out there who feel that they had it in December and they're convinced they had it in December, January on the island, and it just wasn't recognised then. So that might put that myth to bed, or equally it could be proven to be true.
Interesting, and I know a few of my family members thought they had this in December as well. They weren't well at all. The second strand of 5,000 tests is going to be very much the second phase, more random, randomly selected. How is that? How is that just decided?
Well, it's medics. This is never political. I and my political colleagues never get involved on who is going to be tested, and that is one. We got involved to say yes, we would support the purchase of it, and we were pushing for that to happen, but we left our medics. So they will come up with different categories of age group, of male, female, young people, etc. The vulnerable. They're doing everyone who gives blood, for example. I am a type 2 diabetic, and when I next go in for my blood test, never an enjoyable thing for me, but when I go in for it, I always get a good welcome from the people. They're absolutely fantastic with me. It's just me being a big toot. But when I have my blood test, I will also have the test for the COVID-19. Now, that's not because I'm Chief Minister, that's because anyone in my position gets that test, and that will give them an overall picture. So they will decide, our medics, who is the different type of people to be tested.
From the Chief Minister being a toot to the vets, Juan's asking, are we now able to enter the vets with our pets, as people up to now have had to hand their animals over and wait outside?
Yeah, well, I can't see any reason why not, but it's not for me to tell vets how to run their businesses. So if I think whenever I've given these briefings, and we've said right from Monday or whatever date you can now go back, I've never said you must go back. I've said you can go back. It's your choice. What do you feel comfortable with? You know your own situation better than I do. So I'm pretty sure that you can go into the vets now. You can go into the hairdressers. You can go into the pub and have a pint last night, and didn't get the chance to do it because sadly the amount of emails I have to deal with when I get home, it doesn't give you much spare time. But it's up to individuals and the veterinary businesses if they choose to continue that. Well, that's their choice.
Hindsight's a wonderful thing. Let's leave the final question to Derek, because he says, on reflection, Chief Minister, is there anything you would have done differently over the last 3 months?
Right. Well, when you know that there was no roadmap for tackling COVID-19, so we made a lot of decisions, and I think we got an awful lot right. And the people of the Isle of Man can be proud of the team Isle of Man that got us to where we are. For example, we were in the top 10 countries for testing at one stage per capita. We were the first country in the world, and I had to be very careful with the wording on this, first country in the world to introduce the 14-day quarantine period without having any cases. I think Gibraltar were the first to bring it in, but they'd already had some cases. So we got an awful lot right. Obviously, with what we know now and the data, we should have closed the borders maybe 2 weeks earlier, and we should have brought in the 14-day quarantining 2 weeks earlier. That's obviously, hindsight is a wonderful thing, and if I knew then what I know now, then of course we would have done it earlier. That said, as I've said before, we were the first probably in the world to bring in the quarantining before we had a case, but I think there was only a 2-3 day gap between us bringing that in and the case happening, and therefore I suppose doing everything 2 weeks earlier would have been better. But it's everyone else was in the same boat as us, and we were one of the first to do all of the things that we did. But yeah, 2 weeks earlier would have been, and little silly things. I know an awful lot of people got upset with us over the bank holiday, the senior race day. I stand by the fact that it was the right thing to cancel and replace it in August when all our shops, restaurants, pubs, hopefully the weather will be better, because we had a dreadful senior race day. And you wouldn't have been able to go out anyway. So, but we did it to try, and there's people who are unemployed at the moment who don't have any money to go out and have a decent bank holiday. And at that time, you wouldn't have been able to go. Well, we didn't think at the time you'd be able to go and see your family. We still had the shutdown, the lockdown in place. So it was the right thing to do, but we made a schoolboy error in that we forgot it had been laid and timbled. Not to be debated, but just to be laid, because that's what we were doing. We were cancelling it. And before we had a couple of days later, the go-ahead from the Council of Ministers to add on the day in the August bank holiday to give people a long weekend. So we made that was a silly little schoolboy error, which I know upset people. It was unintentional. It was with the best of intentions that we wanted to do it. So you make mistakes as you go along. We're not perfect. I've never made out. People that know me know I'm far from perfect, but those are probably the two areas where I'd have changed things.
Chief Minister, thank you for your time. Really appreciate it this afternoon. Thank you, Alan, as well. He's left now, but in Douglas, for your questions. And thank you all of you who've submitted questions, a plethora of questions we've had as well. We have reached most of them. I'm really grateful as well for the varied and breadth and depth of questions. Just a reminder for a future Q&A briefing, COVID-19 community support at gov.im is the email address, COVID-19 community support at gov.im. I think that rounds us up for this week. All that remains to be said is thank you for your time and have an enjoyable weekend. Thanks very much.
Thank you, James.